Hello, everyone, and thank you for taking time out of your day today to join us for the AHRMM new member orientation. We realize that you are still very busy, so we appreciate you taking time out of your day. With that in mind, we will be recording this webinar for all registrants. So if you have to step away for a bit or hop off for an urgent matter, you'll be able to access the recording. I'll be emailing it to you within the next week or so. So let's get started. My name is Kimberly Green, and I am the Member Engagement Specialist here at AHRMM. Joining us today is Melanie Miller, who is on the AHRMM Membership Committee. We'll be introducing you to your new membership and going over the many benefits available to you. Melanie, please introduce yourself. Oh, Melanie, you might be on mute. Let me unmute you. Melanie, are you there?
I am.
Okay.
Hi, my name is Melanie Miller. I'm an RN and I'm Vice President and Chief Strategy Officer for Silver Lining Apparel. We're a small but mighty woman-owned healthcare apparel company and PPE company located in Los Angeles. And I have many, many years of supply chain, materials management, and value analysis experience in Chicago and Los Angeles. And I've been a member of AHRMM since 1984.
Excellent. So Melanie will have a lot of great information for us today. Thank you so much. So during the event today, we're going to invite you to ask questions. And the best way to do that is through the Q&A box, which can be found by clicking the ellipses at the bottom right-hand side of your screen, opening the Q&A box and typing your questions. And if you can't think of anything during today's event, or if you think of something after today's event, our last slide is going to be our contact information, Melanie's contact information and my contact information. So feel free to reach out to us after the event is over. So today we'll go over a bit about what AHRMM is as an organization, what we can do for you as an individual, what we've done for the profession and the field, as well as talk about the number of opportunities for you to get involved. We'll mostly talk about how you can take advantage of your AHRMM membership, but I wanted to touch on our mission and vision so you can get a sense of who we are as an association and what we're working toward. Our mission and vision are closely aligned, and we work every day to advance healthcare through supply chain excellence. We do that by providing education, venues for sharing and cultivating knowledge, and advocating for the profession. AHRMM has more than 3,600 individual members across the world. We're primarily focused in the United States, but we've had a lot of international growth in the last several years. AHRMM and our members represent healthcare provider organizations, as well as manufacturers, distributors, and GPOs. We also have members who are active duty military, young professionals, and students. AHRMM is governed by a 14-member advisory board. The board sets strategic goals, makes policy decisions, leads advocacy efforts, and develops relationships within the field. AHRMM is also served by 8 staff members in Chicago, including myself. We have over 30 affiliated chapters that are independent organizations, but affiliated with AHRMM National. These self-run chapters are located across the United States and provide various resources for their members at the local and regional level. Our chapters are a great resource for our members, and I encourage you all to find a local chapter on our website by clicking Get Involved on the main menu and then clicking on AHRMM chapters. So what can AHRMM do for you? We have a variety of educational opportunities in multiple formats, so you can learn in whatever style suits you best. These modes include e-learning courses, live webinars, on-demand webinar recordings, podcasts and video webcasts, and of course, face-to-face meetings when it's safe to do so. Education topics are based on leading practices, member suggestions, and what's happening in the field right now. All our education offers continuing education credits that will enable you to renew your CMRP or other certifications you may have. You can view all our educational offerings in the Knowledge Center on our website, located on our main menu under Education and Certification. Also, if you're part of an organizational membership, you can receive an additional discount off the already reduced member prices, depending on your organization's level of membership. AHRMM's annual conference is held every summer, usually in late July or early August. We were just in Nashville, Tennessee last month. Feels like a couple weeks ago, but it was the end of August. So in August 2022, we are headed to Anaheim, California. The AHRMM Annual Conference and Exhibition is the leading education and networking event for the healthcare supply chain. AHRMM 22 promises to be packed with a variety of educational offerings, including engaging keynotes, interactive learning labs, roundtables, quick AHRMM talks, and they are all presented by the field's most innovative thought leaders, along with the opportunity to connect and network with your peers from around the country. We also just finished up our virtual conference last week, and the proceedings for both the on-site and virtual conference are available for purchase right now. I know that our media team is cleaning up everything, and they will be sent out as soon as they are cleaned up and edited, but they are available for purchase. I know there's a promo code out there for the on-site proceedings. So if somebody is interested in that, you can email me and I will set you up with that. And again, if you're part of an organizational membership, you get an additional discount on the already reduced member registration rate. And registration for AHRMM 22 will open in the spring. And I know, Melanie, you've attended some of our conferences, and I know you have some good insight about those.
Well, thank you. The AHRMM conferences are actually very, very engaging and very exciting. When I was a member of a HCO team, I enjoyed going to the conferences because the education was amazing. And you could pick and choose from a plethora of opportunities. And during the conference, you were able to engage with suppliers, you were able to engage with leaders in supply chain, you were able to connect with nurses, physicians. It's been very exciting. Then when I moved into the supply side, I was quite excited. My first supply side was in Washington, D.C. What a great opportunity to have a booth in Washington, D.C. It was an extraordinary experience. Also, what is really exciting, AHRMM has a dotted line to the Association of Healthcare Value Analysis. And so for many years, AHVAP was able to have a booth at the AHRMM conference, and maybe we'll get back to that. But AHRMM it's just a very exciting conference, and there's such a generous spirit. I was also on the annual conference and planning, and that committee is exciting. And part of the role of the members of that committee is to introduce and to become the ombudsman for the sessions. So it's very exciting. You get a, a definitely eye-opening experience into the world of conference planning and into the world of speaker planning. And so it's very exciting.
Thank you, Melanie. Very much so. This year I was a bit more involved in helping with the planning of the conference that I was in years past, probably because of everything with COVID and us being a little short-staffed this year. So it was definitely an eye-opener. So those are all excellent points. Thank you so much for sharing that. So next we'll talk about resources and tools. So traditional education isn't our only way of keeping our members and the industry as informed as possible. We have a multitude of other important resources and tools that can help. The first is our member magazine, Supply Chain Strategies and Solutions, which is delivered to you every 2 months in print and digitally. This magazine includes articles, case studies, and leading practices, and features many other member resources. Since March of 2020, we've been sending a coronavirus update email offering the latest updates and resources to healthcare supply chain professionals about COVID-19. This email also provides a link to our COVID-19 resources page that is updated daily. This resource page also has our vetted supply chain vendors list, which I believe now has over 1,000 vetted vendors, if I'm not mistaken. So, and it's something that we're extremely proud of. So please, if you haven't already, take a look at that. And it's something that we're always updating and keeping track of. So please take a peek. Our weekly e-news email focuses on developments in the field and association news. Our AHRMM Now email is sent on the first and third Thursday of the month and highlights our education and upcoming deadlines to help you make sure that you don't miss out on things coming soon. And our healthcare data standards newsletter is sent monthly and focuses on what's new in the healthcare data realm. Sometimes you'll also receive special announcements and news items as issues arise. And I know, Melanie, you were mentioning something about the COVID email just before we started the webinar.
Absolutely. So the COVID email is very informational. And what I like about it is I'm able to download parts and pieces and send to other organizations in which I'm a member. And the AHA dashboard is amazing. I've actually sent that dashboard yesterday to a friend who's on the fence about vaccination. And I'm looking forward to having a very positive conversation with them later today and going over each of the dashboard items so that it just takes them one step closer to becoming vaccinated.
Excellent point regarding vaccination as well. Excuse me, sorry. As I previously mentioned, our Knowledge Center holds a wealth of information in our resource repository. It includes articles, reports, books, white papers, presentations, and programs. There's actually a lot more in there as well. We also have some resources from our CQO headquarters. A great benefit of AHRMM being part of the American Hospital Association is that members of AHRMM can have up to 4 hours of research conducted through the American Hospital Association Resource Center. This resource is free and a members only benefit. The staff of the AHA Resource Center are research experts and have access to a huge library of sources. If there's anything you need researched, they'll work hard to provide information on whatever you request. And Melanie, I think you were talking about CQO.
Oh,
just
yes.
recently as well.
Yes, absolutely. Cost, quality, and outcomes the work that ARM has put into cost, quality, outcomes is pretty amazing. And there are there's several white papers on CQO. In my company, we have integrated CQO into our website, into our mission and vision. We like to align ourselves with the IDNs, the physicians' offices, the dental practices that that are our clients. And so there's a plethora of information again about cost, quality, outcomes. And coming from a value analysis and supply chain background, I was in AVAP and ARM, part of the original group long time ago, that started the conversations. Dee Donatelli was a leader in that group, and it's very exciting. And CQO hopefully will be spinning off Satisfaction as well. That's been conversation over the past several years, so we'll see how that goes. But the complementary online resources are excellent, and can't say enough about the ability to have 4 hours of complementary research conducted by the AHA Resource Center. That's a gift.
For sure. Yeah. And that's something that I want to say that's only been around for the last 3 or 4 years. And I don't think it's as used as it could be. So we try to market it as best as we can, but I still don't think our members take advantage of it as much as they could. And in regards to CQO, we're really proud of all the information that we've put out there in regards to CQO. And I hear it a lot in speaking with people that are not even members of ARM. So I'm so grateful that it has taken on kind of a life of its own. So really happy, we're really proud of that. So I'm glad that has really taken off. So next we'll talk about networking resources. So we have several networking resources you can use to connect with your peers and get quick snippets of what's happening at ARM. ARM Connect is our online member community where you can ask questions, share resources, connect with other members, and do so much more on that network. So our online community, or I'm sorry, our online membership directory is located within ARM Connect, and that will help you find any ARM member and begin connections that way. And also you can connect with everyone by tweeting your latest successes and news using @ARMTweets. We are also online at LinkedIn. We have a group there, and then we also have our company or organization ARM as well. So there's a lot going on in both of those groups on LinkedIn. So please join us there as well. So in our goal to advance the healthcare supply chain, we want to make sure that you're prepared to excel in what you do and are set up for success. So we have developed career advancement opportunities and resources for you with that in mind. Our professional development matrix is a blueprint that helps to show what a career path may look like within the healthcare supply chain field. It's designed to provide some clarity around the skills required for each level: staff, supervisor, manager, director, and executive. We also want to make sure that you have an accurate picture of what the supply chain field looks like in terms of compensation. So every year we conduct a compensation survey comparing data from the past 4 years. The results of the 2020 survey were posted, excuse me, for members on the ARM website at the end of December in 2020. And you can find this by clicking the resources tab from our main menu on our website, and then click career resources from the drop-down menu. And we will be sending out the survey to collect data for this year's compensation survey within the next few weeks. So please be on the lookout for that email. It's a robust survey. We ask a lot of questions, but if you've had the opportunity to download the 2020 survey, it's really, really helpful in regards to compensation. And I know, Melanie, you've talked about using that compensation survey report.
Oh, absolutely. The compensation survey report came in very handy for me personally when I was in the supply chain leadership role at a large IDN on the West Coast. And I was able to take the survey directly to my boss at the time, um, and share that I felt that, I was deserving. And I put together a list of my accomplishments, my goals that I had exceeded, and actually it worked. It worked to my benefit, and I was thrilled. And he actually was thrilled as well, because he was trying to make a business case for additional compensation, but didn't have all the tools he needed. So the compensation survey report did the. Also,
Excellent.
the career center is exciting because I'm able to again cut and paste and send career center information to my colleagues who are working in supply chain and value analysis.
Yes, and that's something that we send the Career Center email every Friday, which is helpful to a lot of members. I know in this in these tough times, it's not always. We do have some members that are, um, unfortunately, they've been furloughed or looking for a job, so it is really helpful to have that Career Center out there. There are a couple other benefits within the Career Center. We do have resume writers out there that can assist. There's a new benefit that I can't recall at the moment, but we added a new benefit within the Career Center. But it's a wonderful benefit to have. And also regarding the compensation survey, that's a free benefit for members only. Anybody that wants that compensation survey that is not a member, they would have to pay out of pocket for that. So it's a really great benefit to have for a member. So just throwing that out there. So next we'll jump in to the CMRP designation. The CMRP certification is offered through the American Hospital Association Certification Center. The AHACC is an independent body that ensures the certification is accredited and meets industry standards. The CMRP is nationally recognized, and you'll see that it's becoming more prevalent in some of the job postings in our Career Center. AHRMM offers a variety of resource materials in order to study for the CMRP. And in addition, the Certification Center offers a self-assessment exam, which is a great way to determine what areas you feel confident in and what areas you feel you may want to spend a bit more time preparing for. Now, I know, Melanie, you and I were talking about you taking the CMRP exam just the other
Yes,
day.
I'm jumping in feet first, and I'm a little bit late to the game, but there's no time like the present. So I can't wait to be at the next in Anaheim. I'm going to be happily displaying CMRP credentials.
Excellent. That's a great goal to have. And
Yes.
I think with the new year coming, I think a lot of people are going to have goals regarding education and getting, maybe certified in something, and the CMRP is a great way to start. I know we talked about a few years ago, the exam was extremely difficult, and they reassessed the exam, they revised it in 2018. And I'm not going to say it's super easy because it's based on both your education level and your job and what you've been doing in your job. So it is based on a couple of things, but it is less difficult than the previous exam. And if you have all the resource materials you need to study, then it's a little bit easier as well. So, and there are some chapters, some AHRMM affiliated chapters that offer study groups as well. So that wouldn't be a bad idea for people that are looking into getting their designation. Next, we will talk about the AHRMM Fellow Program. So the Fellow Program is available for those AHRMM members who have had their CMRP designation for at least 2 years and are looking to elevate their status in the field beyond the CMRP. The Fellow designation recognizes those who have reached the highest level of achievement in both the association and in the supply chain field. Excuse me. Fellow status is officially awarded during the leadership reception at the annual conference. Keep the Fellow program in mind as something to consider aiming for once you've received your CMRP. And we have a lot of, we call them farms, within the AHRMM membership. So you can always reach out to them through the member directory if you have any questions about their process and how they got there. We are also happy to offer scholarships to our members to help you become CMRP certified, renew your certification, or attend the annual conference. The CMRP scholarship is offered twice a year, with the next period opening in just a few weeks. We try to line it up with the Healthcare Supply Chain Week, which is October 3rd through the 9th. AHRMM awards first-time CMRP examination scholarships and CMRP renewal scholarships. The annual conference scholarships are generously funded by our exhibiting companies, and conference scholarships will open the same day as AHRMM 22 registration. So Melanie, I'll send you a reminder about those.
Thank you.
CMRP scholarships. So I'll also quickly highlight the work we do to advocate for you in the field. As the professional organization for the healthcare supply chain, we've been champions for various initiatives that move the field forward. One major advocacy initiative we've been at the forefront of is the cost quality outcomes movement, which we've talked about just recently. This movement is focused on preparing supply chain professionals for the critical role they play in helping hospitals and healthcare, and health systems understand what drives better quality care at a more affordable cost and delivering the greatest value to patients. If you're unfamiliar with the CQO movement, definitely review the information on our website. Our CQO site has links to all the content that we've designed and developed specific to the CQO movement. There are case studies, lots of frequently asked questions, and leading practices that focus specifically around hospital-acquired infections and other areas where supply chain can contribute to improving patient care and outcomes. We also have some testimonial videos from leaders in the field and reports from events we've hosted in the past. It's a robust educational area to investigate as you're looking to learn more about the field. We also track issues and initiatives relevant to the field. Excuse me. AHRMM's Issues and Legislative Committee currently tracks these and other issues that affect healthcare and supply chain. The INL committee stays on top of developments on these subjects and, when appropriate, put together advocacy briefs to keep members informed of issues that can and will affect the supply chain, your facility, and the work that you do every day. These papers and briefs can be found by searching our Knowledge Center. AHRMM is currently part of several industry collaborations with the goal toward increasing quality, developing best practices, and participating in the broader conversation shaping healthcare. The Learning UDI community, or LUC, is one area of a lot of activity and industry collaboration. AHRMM is passionate about encouraging and advocating for unique device identification, or UDI, adoption. The Learning UDI community helps organizations navigate UDI and implementation, the FDA's regulations, and collaboration with manufacturers. The healthcare learning community was modeled after the successful Learning UDI community. It will continue AHRMM's tradition as an unbiased convener with a purpose of developing solutions through the formation of cross-functional work groups made up of subject matter experts and stakeholders from across the healthcare ecosystem. And the healthcare community, or excuse me, the healthcare learning community was just recently formed within the last probably 6 to 8 months. And you can learn more about these initiatives on our website by clicking resources from our main menu. And let's see, the recently developed AHRMM keys for supply chain excellence are key performance indicators, or KPIs, that set the standard for supply chain management in the healthcare field. The AHRMM keys are basic metrics for supply chain professionals in multiple settings to evaluate the health of your supply chain and move you closer to operating from the intersection of cost, quality, and outcomes. You can learn more about the AHRMM keys by clicking on the resources tab from your main menu. And we'll be adding more AHRMM keys as the year progresses. And we actually are going to be launching a platform in Q1 of next year. So we're really excited about that. Also within that resource online on our website, there is a downloadable PDF for AHRMM keys for members only. So you would have to log in to access that. But this is something that is going to be an ongoing initiative for AHRMM. So we're really excited about it. So practically everything we've gone over today requires our members' assistance. We are successful because of our members and the volunteers that dedicate their time, energy, and efforts to the work that we do. We have a wide range of committees where our members volunteer their time and experience to help AHRMM improve our work and the healthcare supply chain field as a whole. If you're interested in getting to know some new people and contributing, this is the best way to get involved and contribute to the direction and the content being provided by the organization. Our 2022 call for volunteers will open in the fall, which I'm hoping to get it launched the beginning of October. So I know, Melanie, you've served on a few committees, so maybe you can shed some light on your experiences.
Absolutely. Well, membership committee is very exciting, and you really every month get to do a deep dive into the members who are expiring, the new members. It's really fun to send emails to new members, welcoming them into AHRMM. And, you know, it's great because when you are present physically or and on Zooms, then you get to know the new members. And, you know, a new member is a position that's unique in that, you know, when you, especially when you attend a meeting, it's great to be able to reach out to new members and welcome them and make, you know, onboarding is really key to engendering new member support and encouraging new members to participate in all the AHRMM opportunities. The Conference Education Committee is wonderful, as well as membership is. And again, you get that bird's eye view into conference prep and how to choose speakers. You review the abstracts. You choose the theme and the tract for the upcoming conference. And, you know, it's pretty exciting. And that's actually a face-to-face when it's COVID appropriate. But it's a face-to-face conference education committee once a year to help, you know, on over 2 days determine, you know, the theme and the presenters for the upcoming year. And Education Committee, I've thought about it over the years, and once I roll off membership, I think I'm going to have to jump into education. I'll take a year off, but but you always have to have those far-reaching goals. So that'll be my goal in 2 years.
That's a great goal, I feel like. Um, pretty soon you'll be on every committee. Those are good goals. Our charters for all of our committees, so our descriptions for all of our committees are located on our website. And once the call for volunteers goes out, there'll be a direct link to all of those charters. But let's hop to the next slide. So there are 2 ways to become involved. One of the most public ways is by sharing your own knowledge as an AHRMM speaker. We are always looking for subject matter experts to contribute to our e-learning courses, webinars, our shorter webcasts posted on our YouTube, and podcasts. So if you have expertise in a specific area, we encourage you to contact AHRMM at any time. We're always looking for great educational content. So now it is time for questions. If you haven't already done so, please type your question or questions into the Q&A box. These questions can be about any of the subjects we discussed today, which I know was a lot, but it can be anything AHRMM related as well. Chat as well. So I am not seeing really any questions pop up, but I also know that we had to have a couple people leave, it looks like. Let's see. Support for the 340B program. And I'm trying to think what that is. Bear with me one moment. That might be a Mike Schiller question right off the top of my head, knowing Mike Schiller is way more adept at that. Oh, pharmacy 340. Thank you. You know what? That is a Mike Schiller question, to be honest with you. He would know the answer a lot better than I would. So let me type your name down and let me get that information for you, and I can reach out to you separately about that. He will have way more information for you and can kind of go into depth with you and reach out to you separately, if that's okay. That's a good question though, because I did not know the answer to that. Oh, perfect. Thank you. Thank you for providing me your information. That's great. Any other questions? Usually CMRP is a big one for designations. But again, let's hop to the next. And I apologize. I am working from home today, and I have somebody working on the outside of my house, so you may hear some noises, so I apologize for that. But here's our contact information. I'm Kimberly. Melanie is our membership committee member and a member since 1984, I believe she said. So feel free to reach out to any of us for any information, even if it's not a question, even if it's just to find out how her member experience is, or if you have additional questions about any additional benefits, we are more than happy to help. So with that, I'm so sorry. I just hear all this noise next to me, so I do apologize. But with that in mind, we should be all set. Again, thank you so much for spending some time with us.
There's a question about the slide deck being available.
Oh, yes. I'm so sorry. I missed that. Yes. Oh, there it is. Yes. So we recorded today's session, and I am going to, once we clean it up, I am going to email it to everybody. But if you wanted a separate, like if you wanted like it as a PDF, I can definitely send that over to you as well. But now that I have your email address, I'll just send it to you. No worries. I'll get that out to you today then. You won't have to wait for the recording. Does that sound good? Perfect. All right. Well, then we should be all set. I can give you 20 minutes back in your day. Again, thank you all for attending today, and please reach out with any questions. And Melanie, thank you for helping out today. It was absolutely wonderful.
You are so welcome. Have a wonderful day.
You too, everyone. Have a great day, and please stay safe.